welcome to the practice. What can I do for you, sir?
I'm having a lot of lower back pain, and it's causing me a considerable amount of distress. It's affecting the quality of my life, difficult walking, constantly in discomfort, sitting down, very limited mobility. It's really affected the quality of my life quite a bit, and it's miserable.
Gotcha. So the low back pain is causing on. Now, part of the consultation you discussed earlier, understand that leaning backwards makes it worse.
Yes.
Right?
Yeah.
Okay. And another, let's see, so anything else with that low back?
To be comfortable when I'm standing up, I have to tuck my pelvis underneath me, because if it sits normally back, I'm in a lot of pain, so I have to kind of like scoot my hips underneath.
So you have to do a posterior pelvic tilt.
Yeah.
To get comfortable.
Yeah.
Interesting way to alleviate that pressure, tension over there. Okay, so I'm thinking in my head right now, so biomechanically, I'm thinking here is this. So when you have to do a posterior pelvic tilt like this way, because there are actually ligaments and tendons that are attaching from here, okay, and also from here as well, okay. So by tucking in, okay, you're taking some of the tension off of the sacrum itself. So a lot of the things you're discussing during, what you're discussing right now, everything is pointing out to the sacrum, okay, and one of the sacral segments might be a problem. Lenotell sign I'll show you in a moment with the X-ray also leads even more clues saying that no, we really got to focus more on what's going on in the sacrum over here. There's a telltale pattern about that. So we got that component. And another fun part I discovered during the consultation that actually I BJJ as well. So I understand you got a lot of injuries over here, and I see one interesting little, we can see that nice big protruding. So how'd you got that fun little souvenir?
It's from Jiu-Jitsu training. My rib popped out. It popped out, and I pushed it back.
Fun times, right? So yeah, for definitely for BJJ guys, you guys definitely need a chiropractor. You make sure everything's tight position. So we're gonna take a look at everything else as well, because I wouldn't be surprised if you got some shoulder problems, elbow problems, wrist problems, knee problems, feet problems, all because you guys do a lot of grappling and a lot, a lot of grappling and a lot of hooks and everything else. So let's put you back together.
Everything hurts.
I wouldn't be sorry. Like I said, you guys really know how to mess up the joints, so we gotta do a full tune-up on you. Let's take a look, see what we got.
All right, Doc. Thank you.
You're welcome.
Hopefully you can put me back together again.
All right. Well, that's what we're here for. The very first step in the Gonstead examination process is visualization. And I'm looking for certain traits is because when we have a structure that's not out of alignment, our body's defense mechanism, it wants to engage the muscles, try to pull the structure back into alignment as much as possible. So for example, if your head is like over this way, what's gonna happen? Your traps, all them elevated scaps, so on and so forth. It's like, okay guys, let's try to pull it right up to here, right? So when it's in this position over here, my expectation is the muscle on the right side should be tight, muscle on the left side should be loose. In addition to, when something gets knocked out like this, okay, there's some damage, inflammatory process starts, your body's gonna start releasing fluid, what we call edema, okay? Now the edema acts like an airbag trying to stabilize this even more. The trade-off is gonna pinch the nerve, okay, and cause more irritation, more inflammation. In addition to, there's also gonna be more, as a byproduct of inflammation, more heat. So I'm going to use an instrument to help isolate what particular level along the spine there are potential areas of concerns that we need to take a closer look at. Right off the bat, I am seeing already, compared to your left side, there's a lot of muscle tension on the right side over here. A lot of fluid in here around your neck. So I wouldn't be surprised again, with all that grappling and hooks you guys do with your neck and what have you, okay, this is going to be quite a bit of structural damage here. Wouldn't be surprised if something's knocked out of alignment. And also as well, now I'm tracing for pitting edema. So I'm going to mark this one right here. And right here at the mid dorsal road over here, got another one over here. That's no big surprise, because this region over here, not only the nerves to the stomach, It also provides biomechanical function to the shoulder blades as well. So again, BJJ guys, they love messing around the shoulders. They have fun dislocating them, so we're going to make sure those are also functioning properly. And okay, and that's where this fun component we're finding right now, okay, right here, with that left rib. See, we got something going on. Pain over here?
No.
Interesting, because this is bulging out right here. Okay, that's that rib head. So I'm marking that rib head. So there's something going on over there. Tracing all the way straight down here. Okay, this is puffy right here at this low. This looks like the 2S. Slightly puffy on the left side, the S side joint. Not too much on the right. Tender right here?
Yeah.
Yeah. See? So what Dr. Gonstead, the founder of our method, what he found was that swelling in the sacroiliac joint is a good indication of a potential problem that needs to be thoroughly investigated. So we're going to find out, we're going to find out why this is a problem over here. Okay, so with this instrument over here, once again, we're scanning the spine, finding those potential and normal heat readings, and to help confirm what we find. So we could tell something that's most likely long-standing and old, what we call a chronic nerve. The heat reading may go on the opposite side of the inflamed area. Smaller read there. Okay, downside. Okay. So now, looking at the x-rays, I'm overlapping the data I'm seeing along with the data I'm processing right now with your spine. Okay, so this one over here. So even though you feel a lot of pain on here, your left hip, it's moving. I can pivot it just fine. That tells me, no, this is a false positive over there. You may not feel like it. See, right hip is stuck. So you got that swelling right here, just second sacral segment. And I'm looking more lower. Now if there's truly a coccyx fracture or somewhere around there, just lightly touching this, you'd be jumping off the table right now. I'm sorry, jumping off this chair right now. But no, nothing. So that's intact. And coccyx fractures are pretty rare. This one right here, so this 2S, this is not moving at all. This is locked, and it should be moving. In addition to, it's correlating with the history as well. See, that fifth is fine. How's that feel right there?
I feel it lower, not where you're touching.
See, this is not moving though. This is moving. This bone right here, that ain't moving too well. It's not rotating too well here. See, if we rotate this way, it's completely locked this way. It ain't moving.
I can feel that.
Yeah. And that's where that rib head is right here as well. How's this feel right here?
No pain.
But you see, it's locked. It ain't moving. Okay, this is not fun. Got that side slip in here. All right. Feel that huge knot over here?
Mm-hmm.
Yeah. So you also got the knot over here too. Feel that? Your body's trying to protect this. Looks like the fifth cervical over here. 6. Tender right there, huh?
Yeah.
See, that 5 is not moving.
Oh yeah.
Right there. Okay. So now we already covered the basics, which is, okay, so gotta do a posterior pelvic tilt. Leaning backwards in a chair aggravates even more.
Oh yeah.
You know, hard time sitting down for a prolonged period of time. Now, what I see over here, there's a big gap. It's like a V shape. Right at that second sacral segment. That thing is very swollen. Now, it's interesting that I challenged on it, and you didn't exactly jump off the chair, but going on the left side of it, right over here, aggravates things. Now, another thing I'm also take a look at is, I don't see too much sacroiliac joint swelling over here, but I see it more so on the right side. Now, because the way your pelvic foundation is, it's supposed to be level, but it's sinking down on the right hand side, and it's also rotated off to the right, that tells me that you're slightly going like this, and like that. So you're gonna have trouble walking this way. So it tells me that, okay, you got 2 components. So this is one of the old injuries you acquired when you were young, but this problem's also been here for a long time as well, because it's this disc. There's supposed to be a slight little tilt, okay? As in other words, this bone over here, it should be like a little bit here. I never want to see it parallel. This is parallel. So the only way this is going to make a parallel line is that there's a problem in the base foundation itself. So that's that clue that tells me, okay, there's something going on over here. In addition to this foundation over here, normal should be here. You're backwards.
What would cause that, doctor? What would?
Some kind of trauma you acquired in the past. I don't know exactly what, but then again, like I said, is to have this kind of pattern over here and this. Now this is old. This is more than 20 plus years old over here. All right. Now, but the way your body compensated, because if this is more acute, right, this disc, it should have worn out faster, because normal movement of lumbar should move like this. But if the foundation is too unstable, it moves like this, and it will grind the disc away. So that's where your right hip, all right, it disengaged. And that's why this disc, it didn't wear out as fast as I'm expecting it to, okay? Because if that wasn't there, this over here would be very thin. So that's why your body, what it did was biomechanically compensated, okay? This is moving way too much, and that's to explain why you feel as if when I saw charges, oh, that's interesting, I have pain on the left SI joint, but your right is stuck. So that's how your body like compensates. Yeah, right. See, you have trouble rotating your pelvis, so that's what I'm saying. So your body's like compensated and locked up. Just try to get, try to see this, try not to make that thing, wear as much as it could. Now, because of the way your spine is like twisted and torqued, okay, that's what loaded this up like a spring. In essence, your spine, you start doing like this, right? So since it's twisted up, over here, all it took was like over here, all it took was a little more force from any kind of grappling over here, the rib popped even more out, right? So we do have to address this one first, because that's where the triage is. That's your more immediate problem, okay? So we'll adjust this one, calm things down, and also help stabilize the foundation. It should help take some of the tension, some of this tension off of here, so make the rib a little less protruding. But to make it all the way in, on a future visit, I need to address this one, because your pelvis, again, is this way. So I need to, twist it this way. So by addressing this right hip, put it this way, and then we can start straightening out this way, over here. And I'll take even more of that sticking out rib out, and everyone else can see right now. And that's really sticking out over here. So by twisting your pelvis over there, and also I'll twist this mid part over here, we're gonna calm that rib down. We're also gonna set that rib in as well. More fun stuff. I'm also just, we're going up the chain of ladder over here. Okay, yeah, this fellow over here is knocked out. So that's why I'm seeing also your shoulder blades. Okay, this is not level. You see this over here, this scapula over here, this is protruding a little higher up, not as much as over here. So yeah, this left shoulder over here, that's in trouble. Okay, that scapula, we need to set that one over there. And I'm gonna check what's also going on with that shoulder as well. Wouldn't surprise me if you may also knock some bicep tendons out as well, because again, grappling, all more fun, right? In addition to, okay, this is what I'm also seeing here. We're seeing a lot of degeneration going on over here, and also this poor fellow over here as well. So 6 is in trouble, 5 is in trouble, but as we see over here, this is more backwards and more degenerated than everything else. At 5, no, I need to set that one, and it's also tilted this way as well. All right, so that's why we see the rest of your head is like this way. So we have to address that fifth cervical. There's also, looks like you had a good old post-orbital fracture over here. Fun stuff, right? So let me guess, also from BJJ?
No, it's from soccer.
Even more fun. That must have been one heck of a one.
Headbutt.
More fun stuff. So now what I'm seeing here on the sinuses, okay, you do have a left deviated septum. This septum should be straight. Instead, I'm seeing it like this one over here. So let me guess. Been having some trouble breathing through your left nostril?
Yes.
Yeah. And in addition to, I'm also looking at the sinus cavities over here. See how more blackish this is over here? It's more whitish. So because the sinus is over here, the deviated septum is over here, it's causing more turbulence. It's trying to enter into the nasal and sinus cavities. So therefore, since there's more turbulence, there's debris. In other words, we're breathing all this dust and all this garbage inside, okay? Our body, that's what the immune cells are for, and also the mucus, okay? What it does is, part of my job is to capture all that, like a glue trap, okay? Capture all that debris, digest it, and break it down. Because we actually have a lot of digestive enzymes in there, okay? However, because there's turbulence, okay, it's not clearing out as well as it should. So there's more buildup, and that's what all this more whitish stuff is. Okay, that's what I'm seeing in your maxillary sinuses over here. So yeah.
My nose is always running all year round. I've got congestion. I wake up in the morning, I can't breathe. It's
exactly, that's what I'm saying.
Yeah.
You know, you got too much turbulence in there, so we have to realign this so we can start reducing the turbulence and clear all that garbage out. All right. We're gonna set this poor fella back in place. Drop the belly. Keep on dropping. Take a breather, sir. Come on up when you're ready.
That definitely moved in there. Felt it deep.
Okay, walk around, sir.
I feel it very tight.
That's to be expected.
Yeah.
Any other differences you notice, sir?
Oh, much looser.
Good. That's a good start.
Oh yeah. Oh, much. Feel a big difference. Yeah, I don't feel it. I can lean to my left when I sit, because before when I sat, I'd have to sit like this to keep pressure off the left side. But feeling more comfortable, much more comfortable. Yeah.
Nice.
Yeah, feeling good.
Glad to hear. Okay, ready for the rest?
Let's go.
All right, let's do it. Okay, let's start working our way up. And let's, wait, take a look at your rib. Stand up for me, please. Tell me, how's that rib feeling?
That's weird. It's like it's gone in a bit.
I did tell you. Stabilizing that foundation takes some of the tension off, but takes some of the biomechanical tension off of that rib.
Yeah, would you look at that? It's pretty amazing.
How much improvement would you say for that rib alone?
This was like that before, and it's gone like in like maybe like a quarter of an inch.
Let's get the rest.
Yeah, let's go.
Okay. Drop the belly. Drop the belly a little more. I know you're touching a little bit. Gotta relax this right. I gotta set this. There. Breathe. I'm gonna set the rib in next. Oh wow. It's not sticking out as much. Okay, gotta set this a little bit in there. Little drop. Little more. Gotta get a little more out of it. Little more. Good. Okay. Come up, sir.
I feel my muscles are tensing. But this feels better.
How's the rib?
Much better. Yeah, it's not as out. Because I could feel it like a lot more before.
Yeah, we could get a lot more out of it once we start addressing the right hip, but it has to be a future visit.
Okay.
Because I gotta let that sacrum heal up first.
But yeah, like this. Yeah, it's a big difference. This used to stick out quite a bit. Thanks, Doc.
No, you're very welcome, man.
Pleasant surprise. I came for this and finding all sorts of things to fix. Thank you.
Oh, you're very welcome. Let's get the rest.
All right.
Because it's still responding, healing to this. Okay, there you go. And there's that fella. Okay, stay right there. See, this is very superior. Just like I explained before in the x-ray, the shoulder blade actually moved up this way. So now we're going to pump this up. So we're going to superior lateral scap. We're going to set this in. There it is. Okay, now we're going to check the other side. So this one is not too bad, but it's still out. Okay, coming up, sir. Get the shoulders a try. See, I like them.
Oh, it's like smooth. Before, when I would do this, I felt like an impediment to the movement, but now it just feels smooth. Yeah, so much smoother.
Hold that. Yeah, see, bicep tendon's out. See, this is, it's not tracking right. See, the moment I go like this, see, it goes this way. Right here. This over here. See, moves right there. Okay, that's in trouble. Yeah, see, it's smooth. Doesn't do as much. Slightly, but not too much. Okay. Alright, so we're gonna take a look at what's going on now. Have a seat, sir. Now, next I want you to do is put your hand like this. No, your right one. Okay. See, there's a little weak here. See, nice and strong here. Strong here. Little weak there. Yeah. Okay, so we got a little issue there. This one over here. Put your hand out. You're like an Iron Man. Yeah. Right there. Good. Stable. 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 A little unstable here. Okay. Not too bad. There's also weakness with the bicep as well. And I also felt while assessing your right wrist is also in trouble too. So we'll take a look at that one as well. Okay.
It's like I'm Humpty Dumpty.
Yeah, well, the difference is all the King's men will put you together again. Okay, so now here's another assessment I'm checking for. AC is fine. Feel that SC, it's locked. It's not moving too well over there. See this over here? It's also locked. See? Okay, AC is locked here. SC is locked. So SC is locked, AC is locked. Okay. So, the magic behind that is because this second dorsal over here got side slipped. So biomechanically and neurologically it deals with the functions of the shoulders. So we're going to restore that. Okay. And there it is, right there. This is where we need to set the side slip. We're going to reposition the liquid ball bearing back here, restore the nerve function. Like that. Right there. Now, because of the way this fits cervical degenerator, we're going to do two parts.
I'm already feeling so much better just getting up and down the chair. Like before I'd have to stabilize on my right side and slowly come up, but I'm feeling much better.
Nice. Okay. A little more. Relax. Here's part one. Come on up. Have a seat.
I'm getting really excited because I haven't felt good in such a long time. It's been 3 weeks and I'm starting to feel like happy.
Nice.
I was just constantly uncomfortable. I'm starting to feel better and it's making me very happy.
Glad to hear. Okay. So now, reason why I'm doing it in 2 parts is because of the way it's so badly degenerated in your fifth cervical. There's that liquid ball bearing. It went backwards. It also showed over this way as well. So I need to really reposition that liquid ball bearing forward. That's why we did it that way versus the chest table. And now I'm going to finish it by moving a little more center, okay, on the cervical chair. And right now I'm feeling where that liquid ball bearing went. Right there. Okay. Right there, that's where it went. Now keep in mind, because it's so badly degenerated, okay, the liquid ball bearing is not always the same place for everybody. It's unique just to you, and right here is the place, right there. Okay, stand up, sir. Okay, go ahead. Tell me, what's different with the neck?
It's like freer, looser. It's easier to move. I don't feel, before, like when I turn my neck, I would feel like strong pulling along here. And now it feels like much easier, much easier.
Good. Now try the shoulders. See how I like them.
Oh yeah. It's feeling good.
I still gotta get that left bicep tendon. How does this feel? How do your C's feel?
It feels good.
Okay, have a seat. Just right now. Check the SC. So yeah, now that's moving like butter. AC, see? Now that's also moving. SC joint. See, that's moving better. AC, decent, but it's just this. Yep, let's get this bicep tendon. So here, you feel that little part right there? That's your bicep tendon, okay? It's a little tendon right there. So we're gonna hook it. Reposition, it's right there, ready to go. And the combination, right, like that.
I felt that.
Come on up. That was a nice little clunker right there.
Before it would be like click. Yeah. It's like I got WD-40.
Well, we're better than WD-40 right there.
Much better. Thank you.
Oh, you're very welcome. Let's get everything else. Okay. Let's check elbows. Okay. Because all those hooks and grappling you guys do always mess up your elbows or wrists. A little more right there. I'm gonna pump this up. I'm gonna set this. Now we're gonna check your wrist. So yeah, that's not moving at all.
Yeah, I feel it.
Yeah. Let's get this radius back in place. There's that clunker. Surprisingly, the lunate's moving. Oh, no, right there. Get that lunate a little back in place. There's that fella. Okay, we're gonna get your thumb in place. Let's get your fingers in place. MCPs. Oh, how'd you do this one? See, this is almost dislocated. See this? Mm-hmm. That's normal. See, this is moving way too much. Capitate's out. Okay. Let's get this capitate in place. A little more. You really jammed this capitate. A little bit. There it is. Feel that? Mm-hmm. Not hyperextending as much. Okay, let's get this. Get a little more right there. You knock this finger out. Just small tip. This way. Okay. Now, let's check this elbow. Yeah, this is also fun too. Feel that tenderness right there?
Oh yeah.
Yeah, that's swelling right there. You knock that elbow too. There's that fella. Okay, radius is fine. Lunate is not. Right there. There's that fella. Yeah, thumbs out. Let's get your fingers. That one went. Okay, give the elbows and wrists a try. See you like them.
No, it feels good. This one here, like I would feel a pain back here and it's gone. Yeah, I feel like when I would make a fist and do this, or if I grabbed something or held something for too long, I felt it here. Now it's like gone. Thanks, though.
Oh, you're welcome. Okay, Septum time. Go ahead, block off your nose. Okay, try the other. Okay, so you could definitely feel the difference there too.
Oh yeah. This one, it's like barely any air. Barely anything coming through.
Yeah, I can already see it's like tilted this way as well. Okay, let's straighten you out.
I'm just so happy my lower back feels so much better. Oh.
All right. See, everything's bonus now. Okay, so now first things first, we're gonna set this. I also gotta set your nasal bone too. See, this is also.
Yeah, I broke it.
Yeah, it's twisted this way. So first things first, we're gonna set your septum. No, a little more. Nasal bone, let's set it. Oh, whoa. Okay, you really knocked it out. Holy Toledo, it's really stuck in there. There it is, finally. Good. Yeah, left maxillary is stuck. It's really clogged. Left frontal's also stuck. Yeah, left sphenoid is stuck. Okay, coming up, sir. Also.
Oh yeah.
Okay. No, let's do the balls now.
I can already feel it.
Okay, you could throw the trash in there. Okay, now give it a try.
Yeah, much better.
How much better would you say right now?
I would say 60-70% better. Like, I can actually feel like I'm taking in oxygen.
Nice.
Yeah.
Okay. Yep. See, just let it give. Okay. Okay, so tibia's out of that one. Okay. This is also sliding out too. Your fibula's stuck too. All right. Left fibula's stuck. Feel this?
Oh yeah.
There's a lot of swelling in there. So first things first, I have to pump this Baker's cyst out of the way. Because if we set this thing right now, we could possibly pinch that thing off. And we don't want an additional problem.
Yeah, that's tender.
So we're gonna put it back in first, before we set this bone. It doesn't take long, because see, it's already sinking in right there. Now we can set this. A little more, a little more. There's the rest. Oh, tiny bit, right? Good. Be able to slightly out. There it is. There's that fella. Now this feels out. Pump this up. First set it. There you go. A little more. Yes. There's that cuboid. It's like cuneiform's little out. Alright, let's get these taluses in place. Let's get your first metatarsal in place. There's that fella. Checking all your metatarsals. Those are fine. This talus is out. There's that clunker. First metatarsal. Look at that. There's that fella. Keep it still up. Good. All right, walk around, sir.
Feeling better.
Go ahead. Check the knees.
Yeah, before I couldn't turn my hip to the right, like I'd go about this far and it would be blocked. Feeling much better. 80% better.
Nice. How's the feet?
Feet feel loose. Normally, like my ankles are really tight. Like I feel it really tight, but it's like it's loosened up. Feeling much better.
All right. Glad to hear, man. All right. Anything else?
No, that's it.
Okay. We're all set.
Thank you very much. Really appreciate it.
Oh, you're very welcome. All right, sir. Give us some updates. How's everything coming along?
Feeling much better. The pain's gone away. I feel more nimble. I still have difficulty leaning back. I can't lean back. I get a sharp pain. But otherwise, I feel a lot more nimble. The other things that you adjusted feel terrific. Like my shoulders feel great. It feels like they're just moving a lot smoother. My elbows as well. My feet. And the most surprising thing was my breathing. My breathing is so much better. I couldn't breathe out of my left nostril before. Now I'm breathing much easier, and I'm waking up in the morning, my mouth isn't as dry. So yeah, a lot of good stuff.
Yeah, that's great. How's the rib doing?
The rib's doing great. I mean, it's a lot more in, you know, since the adjustment, and I feel like my rib cage can expand like a bit more freely. Like before, I felt like a bit of like a restriction, but now it feels like it's expanding, you know, freer.
Hey, that's great updates right there. Okay, so the low back, we still got more work to, more work to do on that one. So we'll keep it up. Thank you for the updates.
All right, thank you.
Oh, you're welcome. All right, give us lots of updates. How's the low back doing this time?
Low back is much better. I've got a lot more mobility. I've got no pain, rolling out of bed. I'm not feeling that locked stiffness. The only thing is when I do certain movements, I feel like it hits like this nerve, but only when I make that movement. Otherwise it's night and day difference.
All right, hey, that's great to hear. Okay, well, that low back, that's still a work in progress, so we'll keep at it. Thank you for the updates.